Good morning. This is the Wise Owl 2 coming at you from the city where I live. Being a type 2 diabetic, as I am, I'm always fighting for better health. I'm always trying to take care of myself. I'm always looking for information dealing with type 2 diabetes like anybody else. Try to control my sugar, try to eat properly, try to do the right exercises, do a lot of walking to make sure my blood is circulating. A lot of things you do when you're a type 2 diabetic. You gotta take care of your feet, you gotta take care of your, you have to go to all your doctor's appointments, you have to get to make sure you refill your prescription medication to control your sugar. Lots of things you gotta do. Lots of things. Lots and lots of things. Wow. Just to be a type 2 diabetic. But being a type 2 diabetic, by experience, I noticed one thing. That as I learn things about my disease or whatever condition, type 2 diabetes, I can also teach things to others as I go along. You know, trial and error, things that you learn as a type 2 diabetic throughout the years or as time go by. I noticed that I can also help others with type 2 diabetes. Since I'm losing weight, my sugar is going down good. It's very good. But I'm still in a little trouble. One thing I noticed about the type 2 diabetes, and I noticed about myself, is that my legs, especially around the shin area, it's always itching. Always itching. And every time I scratch very lightly, the itch doesn't go away, and it leaves a mark later on, a scratch mark. And it keeps itching and itching. All my studies, all my itchiness, and all my scratching, I had to do something about the situation. But what? And then I started to do more studies and find out that people with type 2 diabetes are liable for skin dryness of the skin. Yes, people with no diabetes at all also get itchy skin, and they scratch too, and they get marks on their legs, or like anybody else. It's normal. But for a type 2 diabetic, as myself and others like me, it's more severe. The cases of dry skin and marks on your legs. Also, what's common or more prevalent is bacterial infection of these marks if not treated correctly. So you have to treat your dry skin, and you got to treat the skin marks. So what do I do? So what am I saying? What am I trying to? What message am I trying to give forward to you? What advice? Am I giving you any kind of advice? I sure am. As I have been studying about my condition, as I have been experiencing through trials and errors, I discovered 4 things I'm going to require for my dry skin and for my skin marks, my scratch marks, and my bacteria infection, on my legs, by the shin area. And this is what I'm going to tell you right now. 3 to 4 things that I noticed. 1, you have to always have hydrogen peroxide with a piece of cotton ball or a cloth, anything that's clean and not with no germs. You know, it's got to be clean. And you soak the cotton ball or the rag or whatever you're using, material, in the hydrogen peroxide, and you put it on your scratch mark. You can wash it with water first, but you have to be careful how you not to rub it and make it deeper. It's better just to get the cotton ball and just apply the hydrogen peroxide to the skin mark. Then you can get this over this next medication you can get over the counter, but I'd rather go to my doctor's since most likely I have a medical insurance. I must well do it. X for hydrocortisone, 1%. Cortisone. Can you see it? It's a cream. Hydrocortisone cream, 1% I believe this is. I put on my glasses, my reading glasses. Yeah, 1%. Hydrocortisone, 1%. You can see right here, it's a prescription. And it's R. Right here you see the R and you see the only. It's prescription only. I'd rather get it that way from a doctor than over the counter. Over the counter may not be as strong and may not be right. Now when you start itching, don't scratch. Put the hydrocortisone, 1% cream, on the area that you're itching. Put it on there, and the itching will stop, and you won't have to scratch. Believe me, I like scratching. It feels good to scratch a itch. It feels good, but it's not going to stop. Okay? Okay. Also, you may have an allergy. So put this there in case it's not your itch is not maybe not be due to dry skin. It may be due to allergy. Still use this. Okay. Now they have an allergy itching cream. If you want to purchase that over the counter, try that. But I haven't used that yet. I used the cortisone cream. Okay, 1%. It has the USP mark on it, as you can see, right there. Okay, and of course Neosporin. First you clean your wound up. First you use the hydrogen peroxide. Then you put the Neosporin around the scratch mark. I don't know if it's safe for you to put it on the scratch mark. It says here it's only for topical use, not for wounds or put into cuts. Sometimes I do put it in there if it's severe, because I'm a type 2 diabetic. Then I put this on. This is for diabetics, dry skin relief. If you have dry skin and you're scratching and itching because of dry skin, not allergy, and you know it's dry skin because you're diabetic, you want to like to put this Gold Bond Ultimate. Now this is selling off the shelf like crazy. No matter what, when I go to Walgreens or I go to Sunrays or wherever I go, people are buying this all the time. It's good to have more than one tube of this, because one tube is not enough. You're gonna use this probably all the time. Okay, this is good, and this helps relieve if you're scratching because of dry skin and you're leaving scratch mark because of dry skin. You're gonna want to use this. A lot of my marks are very light. My scratch marks are very light, and they're going away because of this. So, Gold Bond Ultimate is the best thing for your dry skin. Okay. Unless you want to go to the doctors and ask him for his own prescription recommendation, it's up to you. This is the best thing here, and everyone is taking this off the shelf like crazy. So you have to run fast to the store to get this. You have to go to the diabetic section, product section. You may not find this in the regular section where everybody goes for dry skin, but you might find this most likely by the diabetic product section, by the pharmacist usually. Okay? Gold Bond Ultimate. It works. So the 4 things I recommend. Okay? If you have dry skin, I'm not saying you have allergy, but dry skin, and you're always itching by the shin area of your legs, and no matter how you scratch, it just won't go away. You're gonna have to get hydrocortisone, 1% cream. Okay, and put it around your legs. Every time you don't want to scratch, it'll go away. And if it won't go away when you put a little bit, then put more. Put more around that area at the most high, and it'll go away. And hydrogen peroxide, of course, with cotton ball or some kind of rag or applicator. Neosporin for around the scratch area or on the scratch area if the scratch area is very light, not too deep. Okay, I'll put it around the area to kill the bacteria. Okay, if it's not too deep, I put mine right on my wound. I shouldn't do it, but I do it because that's how I won't get no bacterial infection because of that. I'm a type 2 diabetic, and this for the dry skin afterwards to heal the dry skin, not only around the area but around your whole leg area, even on your calf, around your shin area where the problem is. On my knees, you get scratch marks on your knees too. I haven't gotten them on my thighs yet. Okay? And always lift your legs up high, above your heart. Okay? And do a feet pump. Feet pumps is when you go like this with your feet. Your feet is high like this. Your feet is high, and you're going like this and bending your toes and everything when they're high. Okay? Be careful not to leave your legs too high. One time I left both my legs up too high, and my right leg was very numb. It fell asleep. And when I went to, oh my goodness, I went to get up. I took my legs off. I went to stand up on both my legs, and boom, I fell on the floor. I had to smack my legs to wake my legs up and everything. Be careful how long you leave your legs up, okay? I got scared being a type 2 diabetic. I thought, oh my goodness, they're going to chop my legs off. I'm so very numb. It's not. My right leg fell asleep. And believe me, you're going to be on the floor. You're going to fall if you try to get up. And you're going to be smacking your legs and waking them up. Wake up, wake up. So be careful how you lift your legs and how long you lift your legs. And because what you may have, if you get swollen legs, it's not because, it may be because you sit down too much, you walk too much, or because when you sit too much, your lymphatic system, your blood and fluid goes to your feet. So you have to lift your legs all the time, okay? I got scared being a diabetic. I thought, oh, they're going to chop my feet off. They're going to amputate my leg. It's not that. It's that I sit down a lot. Sometimes I even fall asleep on my chair. Now I go back to my bed and fall asleep in my bed and I walk around. When you sit down too much, like on the computer, if you have a job at a desk computer, walk around some and massage your legs. And go to YouTube and look up lymphatic drain of your legs. They show you how to massage the fluid from your legs. They show you how to lift your legs, massage it, and everything. I can teach you how to do that, but maybe some other time. I'm by you now. I'm trying to teach you what to have. When you keep itching and scratching, it may be the dry skin or maybe due to allergy. If it's due to allergy, then you can have creams for that. I haven't used that. I have used Go Bond Ultimate for that, and I've been having that's for dry skin. And I've been using hydrocortisone cream, 1%. Put this on your skin always. Go to your doctor if you're itching all the time. Because when you scratch, later on, the scratch mark will appear as an open wound, a deep wound or a light wound, a scratch mark. Use this to overcome your itchiness. Go to your doctor around your shin area. You're going to get it. It's going to happen. And control your sugar, or you're going to start getting blotch mark or hypopigmentation mark, dark skin marks on your shin because you're a type 2 diabetic. You can get rid of that. Okay? Now, control your sugar and you should be okay with that. Or you can try Retin-A. Retin-A and sunblock when you go out in the sun for those high pigmentation, hypopigmented black marks on your legs. Okay, so not everything that happens to you is caused by diabetes or high sugar. Something's just caused by the sun and by carelessness in skincare. Okay? Okay? So don't worry about it. If you get those marks in your legs, a lot of those, go to your doctor. He may have a formula for that. Sometimes it may be caused by diabetes. I have a friend of mine who's on insulin, and he got those very badly, those black dark marks on their legs. Some of these dark marks are not caused by diabetes. They're caused by insect bites that from the old days. If you used to get bit by a lot of insect or stung by a lot of insect, and you do a lot of scratching, and which is, you shouldn't have done that. You should use hydrocortisone or calomel lotion or something like that. Because of that, you're left with dark marks, bite marks, or going to be dark and blotchy looking. So it's not caused by type 2 diabetes. It's caused by carelessly scratching the marks in your legs, and then many years go by and they become dark. That's what happened to me in my leg. I'm going to try some Retin-A and some sunblock. That's what I recommend. If you see here, in the Neosporin box right here. Neosporin sits right here in a tan brownish box. It says pain, itch, and scar. Right here. Pain, itch, and scar. Okay? So, okay? And it's a multi-action ointment. 24 hours infection protection. Maximum strength, pain, and itch relief. Okay? Minimizes the appearance of scars. You see that? So, use this, okay? For your scratch marks. I use this. Hydro peroxide. I used this. Neosporin. I use hydrocortisone cream, 1%. And I use this, Goban Ultimate. And these things are leaving the shelf like crazy. If I were you, I'll buy more than one of these. More than one of these. I'll stock up on this. And this, they're very cheap. They always have a special. Buy one and get one half price. Okay? I have a whole closet room full of these. If you go to my Wise Owl 2 site, subscribe to my Wise Owl 2 site. That's who I am. You see that I have more than one of these. I go shopping for more than one. I show myself shopping for these. I always go shopping for supplies. Emergency and situational storage. That's what it's called. Or home storage. You should always get more than one of anything. Whenever you go to the store. If you can't afford it, then try to get one at a time, or I should go shopping each week. If you have extra money left, one at a time, go shopping and stock up little by little. That's what I do. You need that unit. But you need your you need your cortisone. Okay? No, you need your Neosporin. You need this. Go to your doctor mostly. Tell your doctor you've been itching a lot and scratching a lot. He'll recommend. Ask him, can you prescribe hydrocortisone cream 1% to you? Ask him if you can do that. He'll probably say, oh sure, why not? He knows you're type 2 diabetic. Okay. Now, if you want to try an over-the-counter allergy cream for itching and allergies, go ahead. Be my guest. If you are prone to allergies, like I'm prone to allergies too. I have allergies too. My doctor will give me Zytec, okay, but not Zytec by its name. He'll give me a different name for Zytec, okay, and stuff like that, okay. If you get rashes because you have allergies, especially at nighttime, I really itch through nighttime. Go to your doctor. He'll recommend creams. He'll recommend medicine for you to take, okay. Because you may be, especially after it rains, you may have mold, rashes from mold. Because when it rains outside, there's mold outside, and you may be susceptible to rashes. So talk to your doctor always, okay? So all these things I just mentioned, buy them, okay? You should get more than one of these, okay? Believe me, these are leaving the shelf like crazy. I went to Sundays. Only one left. I go shopping for this at Walgreens. And Walgreens, I went one time to Walgreens and the shelf was loaded with these. I went back a couple of days after to get a home storage of these. One left. People are buying them because they work. It's good. And if you're not diabetic and you still suffer from dry skin, buy this anyway. Okay? So if you like my video, give me a thumbs up. Subscribe for free to my Wise Out 2 site or channel. Leave a comment or two about your experience with dry skin, and or give me a thumbs up, or share with your family and friends who are diabetic, who needs this video. Okay, this is Wise Out 2 coming at you from the city where I live and the city where I love. Have a good day and good luck with your type 2 diabetes and dry skin. Bye-bye. Over and out.